10, 20 kilometers, go to a dispensary. They can walk during pregnancy. They can, because take the case of Tanzania, attendance at antenatal clinics is over 94%. But at least they have the strength to go. But giving birth, only 47% give birth at dispensaries and proper health facilities. 53% give birth at home. It's not like here in the US, where giving birth at home is a matter of choice. You can just decide that I want to give birth at home. But in our part of the world, people give birth at home. It's not a question of choice. Simply, the trained midwives are not there, and they cannot walk or be put on top of a bicycle, take her to a dispensary 20 kilometers away. So they've got to be able to give birth at home, under the hands of traditional birth attendants, who unfortunately do not have the education to be able to have the modern education. It is a skill and a knowledge that has been passed on through oral tradition. I was born under the hand of a traditional birth attendant. And many people my age actually were born under the hands of traditional birth attendants. So they are skilled. If I can be healthy as a president, it shows how skilled they are. These are skills that have been passed on through oral tradition. And you say, we cannot go on this way. And this explains why there are many deaths. So when there is complicated pregnancy, they cannot be able to detect it. And if a mother cannot deliver because the baby is not sitting properly, then there is nothing they can do. It's just wait until this mother dies. I can tell you a practical experience that happened to me when I was a member of parliament. I was in one of the villages. I was addressing a meeting under a mango tree, huge mango tree. This is the life in Africa. And then on the road nearby, I was seeing about 4 people pulling a bicycle. Behind this bicycle, there was a huge basket. There was somebody in that huge basket made of bamboo. I knew it must be a sick person. So after finishing the meeting, I was driving away, and I was going towards the direction of where these people had gone with the bicycle. After about 2 or 3 kilometers, we catch up with them. I stop, ask what's wrong. They say, here is a lady who has been in labor for the last 3 days. She can deliver. And they're now taking this lady to a nearby health center. And the nearby health center is 28 kilometers from her home. So she can't walk because of labor pains. So they had to improvise with this bamboo basket, take her on the back of the bicycle, and then, because they can't ride, then they're just pulling the bicycle. And then I said, okay, fine. I told everybody from my car to just come down. I said, okay, take this lady to the hospital, and then come back for us. And they still had another 23 kilometers. So then they took her, they went to the hospital, they came back for us. Then we went to that village, had a health center nearby. I went to a meeting, after that I went to the hospital. Then the lady delivered safely by cesarean section. The boy, the baby was a boy. Don't they gave the boy my name. I said it's not necessary. It's about, it just goes in appreciation. So you can see how many ladies go through this stage on that. That's why we have given maternal health a top priority. Healthcare itself is a top priority again, but maternal health occupies a special place because of these kinds of situations. So, but what I've been saying, which I'm saying again, is that governments in Africa are aware of this. We have taken it upon ourselves to invest in healthcare. When I came into office 2005, the budget for health was 6 in terms of allocations. Now it is number 3. We pushed it up. We pushed it up upwards. Now we're doing so much, and maternal health, child health is on top of the list in terms of budgetary allocations and in terms of budgetary. But of course, we are governments of poor countries. When we say that we have increased per capita, we have increased budgetary allocation, Dr. Mtasiwa, sasa hivi tunatumia kiasi gani kwa kila mtu per capita?
$14. 14.
Yeah. Kutoka ngapi?
Tumepanda kutoka from 12 to 14.
So we're not bragging that we've increased the health budget, but per capita expenditure from $6 to $14. It's good for us, but what is $14 per capita expenditure? So this is one aspect. But we are talking of situations where there is a lot of scarcity of medical personnel. The ratio of patient to doctor in Tanzania is 1 to 50,000, 1 to 30,000. The ratio of nurse to patient is 1 to 23,000. So that's why, what is the ratio in the US? One doctor attends 300 patients. That's why there's plenty of time. You have to make appointments, or when you see a doctor, the hour. In Africa, it's a pastime. You can't afford. People just walk to the dispensary. They'll sit the longer hours, and the doctor doesn't even have time to really have time with the patient, ask the medical history and so on. Just a few minutes of attention, because there are so many others waiting outside. So these are some of them. That's why we also, besides investing in building dispensaries, increasing access, we're also looking at how do we close the health professionals gap. We're investing in training doctors, nurses, health professionals. So I'm saying we are in a challenging situation. This is the situation in Tanzania, in Kenya, in South Africa, even if they are better developed than the rest of the continent. But with a history where the majority of the people live, these facilities are not there. So you have these islands where there is a lot of development. But when you go out now into the countryside, where the majority of the people live, the situation is just like any other African country. So these are the situations that we're working on. Look at the medical equipment that we need for treatment, diagnosis and treatment. Until recently, how many MRI scans we had in the country? There was none. How many do we have now?
We have only one.
on the ground. How many CT scans do we have now? Four. We've just recently acquired dialysis machines, and we are bragging about it. You know, so there was a time I visited South Korea. I was talking to the president there. I said, look here, you guys now have gone 3D. The 2D, 1D equipment is obsolete. If you give it to us, it's going to be state of the art. Yeah, if you are not concentrating, Governor, if you are not concentrating on the 3D or 4D technology of the MRI scans and CT scans, just give them to me. They'll be state of the art. You will save so many lives, because people die of brain hemorrhage. You cannot diagnose it correctly because you don't have the CT scans, you don't have the MRI scans. So, briefly, it looks graphic, but this is the truth. The truth. What I'm saying about Tanzania is the reality for most African countries, but we have not given up. We are saying these are the challenges, and that is why we are leaders. We are now working on how to overcome those challenges. So we do it ourselves, but when we have friends like Bill Richardson, like you, all gathered here around the table and ready to work with us, ready to extend support, buttress our efforts, then we get home. And this is precisely what is going on. The Presidential Malaria Initiative has done wonders. PEPFAR has done wonders. With the support from the United States government in Zanzibar, today we have eliminated malaria. Yeah. We are now working on mainland Tanzania. So, with support from friends, definitely we would be able to get to the next level. So I consider this meeting of ours here very critical. I thought you should know a bit of it, and I've not said much about it, but there is so much to tell about the health situation on the African continent. And well, sorry, I've spoken too long because I'm a politician. I thank you.